This is Todd Ponsky from the Journal of Pediatric Surgery, and here's your 2-minute review. Today we're going to review a study called Use of Balloon Dilatation for Management of Postoperative Intestinal Strictures in Children with Short Bowel Syndrome. This is a study that addressed the question of how do we manage strictures in babies with short bowel syndrome. Traditionally, we resect these strictures, which leaves them with even shorter bowel. And is there a role for balloon dilatation? So, reviewing this article with us is Dr. Courtney Paisano, who is a second-year general surgery resident, soon to be a research fellow at Nationwide Children's Hospital in Columbus. Courtney, tell us about the study.
So this was a retrospective study that was done between the years of 2011 and 2015. They looked at patients that had intestinal failure. So the mean age of the children they looked at was 4.4 months. And what they did was they used a less invasive way to treat these strictures. So they used balloon dilatation in 6 different strictures. So it was 5 patients and 6 strictures. So one patient had 2 different strictures. And they found that in 4 out of the 6, or 67% of these patients, the balloon dilatation actually solved the problem of the stricture, and they followed the patients out for 3 years with no return of the stricture.
Okay, and what about the other 2 that didn't succeed?
So they did have one of the failures, which was a perforation. It was a contained perforation that did not require surgery, but did have to be treated with antibiotics.
Okay, all right, so what were your thoughts of the study?
So I thought this was a good study, and I thought that it brought to light another way to treat children with intestinal failure because, number one, it's a less invasive way to treat it, and number 2, it really can preserve bowel length in these children so that down the road they don't suffer from short gut syndrome.
Yeah, I agree. This is certainly going to impact my care. This is something I'll absolutely consider in these patients, and I'm curious what you guys think, so leave your comments below. Thank you, and we'll see you next time.